All right. Strap in, everybody, because we are going deep today.
Deep. Yeah.
Yeah. Deep into
Okay.
excited delirium.
Right.
You've maybe heard about this out there in the news headlines.
I am, yeah.
But we're going to take a look at a guideline for paramedics
Okay.
that basically tells them
Yeah.
how to respond
Mm-hmm.
to someone who's experiencing this condition.
Right.
And this is going to be a wild ride.
It is fascinating.
Yeah. So what's
Yeah.
interesting about this guideline
Yeah.
is that it really is this like
Yeah.
combination of your physical body,
Right.
your mind, your psychology,
Yeah.
and then also like what's going on in society
Yeah.
all wrapped up in the
There's
one.
a perfect storm.
So the guideline says
Mhm.
that excited delirium is basically
Yeah.
impaired thinking
Right.
and
Yeah.
violent struggling.
Uh-huh.
Okay. And then
Yeah.
it can be caused by drug abuse,
Right.
alcohol intoxication,
Yeah.
psychosis.
Exactly.
And it even says, well,
Mhm.
these people are at risk of sudden death.
It's a very serious condition.
Oh, yeah. Scary stuff.
Yeah.
But, okay, so
Yeah.
then it goes into a list of symptoms,
Okay.
sweating, fever, all that,
Uh-huh.
kind of the
The
usual.
usual suspects.
But then it says impaired thought processes,
Okay.
hallucinations,
Right.
paranoia.
Mhm.
Does that mean
Yeah.
everyone with this is dangerous?
That's a great question, and it's
Uh-huh.
not so simple.
Oh,
You have to imagine you're seeing things,
right.
hearing voices.
Yeah.
It's
That'd be scary,
it's terrifying. You don't know what's real.
right?
So yeah, it can lead to some unpredictable behavior,
I can see that.
but it doesn't automatically equal violence.
Okay.
It's a spectrum.
Gotcha.
Yeah.
Okay, next.
What else we got?
It says unexpected physical strength,
Oh yeah,
like
this one.
breaking handcuffs, bending steel.
Right. Like superhuman strength.
Yeah, how is that even possible?
So their body has this amazing stress response.
Oh, adrenaline.
Adrenaline,
That's right.
hormones go crazy
Mhm.
boosting your strength. You don't feel pain as much.
Oh,
Like there are stories of people lifting cars
no way.
to save someone trapped underneath.
That's incredible.
Yeah, it's survival instinct in overdrive,
Wow.
but we got to be careful,
Okay.
especially when the police are involved,
Right.
because someone might seem more dangerous than they are.
I see, yeah.
Yeah.
Okay, another one here.
Mm.
Significantly decreased
Mm-hmm.
sensitivity to pain.
Oh, yeah.
So, like, they could be hurt
They might not even realize it.
and not know it,
Right.
which is dangerous.
Exactly. It's dangerous because
Right.
they could keep pushing themselves,
Yeah,
make
yeah.
the injury worse.
Oh, that's tough.
Yeah.
Okay, so now the guideline gets into
Yeah.
what paramedics should actually do.
Right. How to respond.
And a big thing is safety.
Yeah. Safety first
For everyone.
for the patient, the
Yeah.
paramedics, everyone around.
Makes sense.
It can be a chaotic situation.
Absolutely.
Mm-hmm.
But then it says
Yeah.
sometimes you might need to call the police.
Oh.
And that feels tricky.
It is a sensitive issue.
Yeah.
Police and a mental health crisis.
Right.
It's a delicate balance.
Yeah.
You need to protect everyone,
Mm-hmm.
but you don't want to make things worse.
Right.
It requires training
Yeah.
and understanding.
Okay.
Yeah.
The last thing they say is
Mm-hmm.
be prepared for rapid deterioration.
Whoa, this is important.
What's that mean exactly?
So, excited delirium.
Yep.
It's unpredictable.
Okay.
Someone might seem okay 1 minute,
Right.
and then bam, their heart stops.
Oh, wow.
Yeah, it's a sudden medical emergency.
That's scary.
That's why a fast response is so important.
Right.
Every second counts.
Well,
I-
this has been really interesting.
I-
And honestly, kind of scary too.
Yeah, it's serious stuff.
But thanks for explaining it all.
It's been a pleasure.
So everyone listening,
Yeah.
think about this.
Okay.
How can we use what we've learned about excited delirium
Right.
to better respond
Mm-hmm.
to all sorts of mental health emergencies?
That's a question we all need to consider.
Yeah,
Yeah,
that's something to think about.
it is.
Until next time.
See you then.
Bye.
Bye.
All right. So we've got this really cool set of guidelines to dig into today.
Okay. Yes.
It's actually pulled straight from the extremity injury standard, which sounds pretty intense, right?
Yeah, a little bit, I guess. But it's basically like a paramedic's go-to manual for, handling those critical moments after an injury, especially to the, arms and legs.
Right, like when things get, well, a little messy.
Exactly.
Now, I'm thinking our listeners might be maybe prepping for a wilderness first aid course or something like that.
Could be.
Or maybe they just want to feel a bit more prepared for, emergencies just in case.
Always good to be prepared.
Definitely. So wherever you're tuning in from and whatever your reason is for being here, we're going to break this down, nice and easy and pull out those essential tips, those gold nuggets of knowledge.
Sounds good.
So first things first, what really struck me is this huge emphasis on checking circulation, sensation, and movement.
Right. CSM.
Yeah, CSM for even think about splinting and then again afterwards.
Makes sense, doesn't it? Got to know what you're dealing with from the get-go.
Oh, absolutely. But why check again after you've, got the splint on? Isn't that supposed to be like fixing things?
Well, it is, or it should be, but we have to be sure, right? Think of it this way. You've got a broken bone, say.
Like a snapped twig or something.
Exactly. And the splint is there to hold everything in place, nice and aligned so it can heal up properly. But, and this is important, if we're not careful, the splint itself could actually end up pressing on a blood vessel or a nerve.
Oof, not good.
Not good at all. We could be doing more harm than good. So that second CSM check, it's like our insurance policy. It tells us if the splint is doing its job right or if we need to, make a few tweaks.
So it's really about spotting those warning signs early on.
Exactly. Anything that tells us the splint might be causing problems.
Gotcha. So what are we looking out for specifically?
Okay. When we check circulation, we're feeling for a pulse, first and foremost. And we're also looking at capillary refill. That's how quickly the color comes back to the nail bed after you press on it. It should be pretty quick, just a couple of seconds.
Oh, right, right.
For sensation, we're checking if they can feel us touching different parts of the injured limb. Can you feel this? Can you feel that? That sort of thing.
Gotcha.
And for movement, we're looking to see if they can wiggle their fingers or toes, depending on the injury, of course. If any of these things have changed after we put on the splint, that's a big red flag.
It's like, hold on, something's not right here.
Yeah, exactly.
Okay, that makes total sense.
Sure.
So now let's dig into this splint as found principle.
Yeah.
I mean, on the surface, it sounds pretty straightforward, but what does that actually look like in, a real life situation?
Okay, so imagine this. You come across someone who's taken a nasty fall, and their arm is bent at let's just say it's bent at a really weird angle.
Yeah, ouch.
Now, your gut instinct might be to try and straighten it out, right?
I can see how you'd think that.
Yeah, totally. But actually, that's the worst thing you can do.
Really?
Oh, yeah. Splint as found means immobilizing the joint exactly as you find it, no matter how strange it looks. Trying to move things around could make the injury even worse.
Oh, wow.
You could even end up damaging nerves and blood vessels in the process.
Okay, so we're basically creating this protective shell around the injury, just holding it steady until, the pros can take over.
Exactly. But, and there's almost always a but, there is one exception to this splint as found rule.
Oh, what's that?
Well, if there's no pulse, or if the fracture is at a really severe angle, then we're allowed to use gentle traction.
Okay, now that sounds like it takes a lot of, experience to make that call.
Yeah, it does. In these situations, getting that blood flow back becomes the top priority. And gentle traction means we're pulling very slightly and steadily on the limb, just enough to hopefully align the fracture and take the pressure off those blood vessels.
So not just yanking it back into place.
No, definitely not. It's all about being super careful and stopping immediately if there's any resistance or if the person's in a lot of pain.
Right. Makes sense. Now, I noticed there's a specific instruction for femur fractures.
Uh-huh.
And just for our listeners, those are the breaks in the thigh bone, right?
Yep, that's the one.
And the guideline says traction splint unless there's a partial amputation. Now, that sounds pretty intense.
Yeah, femur fractures are no joke. Think of your femur as like the main support beam for your body.
Right.
When it breaks, it can cause a lot of instability and pain. And traction splints, they use this gentle pulling force to help align the broken bone and ease those muscle spasms that can be incredibly painful.
Oh, I bet.
But if we're talking about a partial amputation, well then, controlling the bleeding and preventing further damage to the limb, that takes priority over everything else.
Okay, so it's like a whole different ballgame.
Exactly.
All right. Moving on, there's this one tip that I just love, and it's all about, getting creative.
Tell me more.
So if you're in a situation where you don't have a regular splint that fits, especially if you're dealing with a child, the guideline actually suggests splinting body parts together.
Oh, yeah, I love that one.
Isn't that so practical? Like you could use one finger to splint another finger?
Exactly. Emergencies often demand a bit of, thinking outside the box. And this guideline is a great reminder that we can use anything we have on hand to provide the best care possible.
Like turning everyday items into lifesavers.
Exactly.
So back to the CSM checks for a minute. If there are any concerns during the initial assessment, the guidelines recommend rechecking every 10 minutes. Now, why so often?
Because injuries, they're not static. They change over time. Swelling can build up, blood flow can get restricted, and things that seem stable initially, well, they can take a turn.
Right, things can shift.
Exactly. By checking regularly, we make sure we're staying ahead of the game and catching any potential issues before they become major problems.
Like a constant vigilance thing.
Yeah, exactly. Always be watching, always be assessing.
All right, so to wrap things up, we've covered a lot of ground here.
We have.
We've learned about the importance of those CSM checks, before and after splinting. We talked about the splint as found principle and when we might need to deviate from that a little bit. And, of course, we dug into the specifics of dealing with those tricky femur fractures.
It's all about having that foundation, that basic understanding of how to care for these kinds of injuries.
Absolutely. This has been really eye-opening, even for me.
Definitely. And remember, folks, this is really just the tip of the iceberg.
Right, just a starting point.
There's a whole world of knowledge out there waiting to be explored, especially if you're interested in first aid and emergency medicine.
Yeah, never stop learning. Well, that's all the time we have for today's deep dive.
It flew by.
It did. And hey, even if you never have to use this knowledge in a real-life situation, it's always good to be prepared, right?
Absolutely. Knowledge is power, as they say.
Thanks for listening, everyone.
Stay safe out there.
We'll catch you in the next deep dive.
See you then.
Bye for now.
Bye.
Okay, so today we're doing a deep dive into something we all know a little too well.
Fevers.
Yeah, fevers.
It's a classic.
We all know what it feels like to be kind of burning up,
Right.
but we're going to go beyond just like, taking your temperature and stuff, and we're going to look at these paramedic guidelines that we have here to see how paramedics approach a patient who has a fever.
This should be good.
Yeah, because I think sometimes we kind of take it for granted,
Totally. Especially as adults.
You just feel bad. You think, oh, I have a fever?
Yeah, you pop some Tylenol.
But like, there's so much more to it.
Oh,
right?
yeah. There's a lot more going on under the surface when it comes to fevers. And for paramedics, they have to be able to quickly figure out what's causing that fever because it could be a sign of something really serious.
Yeah, so just like right off the bat,
Yeah.
when a paramedic encounters a patient with a fever,
Mm-hmm.
what are some of those things that are going through their mind that they have to consider?
So the first thing they're thinking about is ruling out any life-threatening possibilities. Okay.
So things like drug overdose, sepsis, meningitis, heat stroke.
Wow.
Yeah, all of those things can actually present with a fever.
So, like, they're not just thinking, oh, this person has the flu.
Exactly. It's not as simple as just, oh, you have a fever, you'll be fine.
Yeah.
They have to consider all of these potentially very serious things right from the start.
Okay, so let's take an example here. So let's say someone calls 911
Right.
because they're feeling sick, they've got a fever.
Yeah.
Paramedics show up.
Uh-huh.
What's kind of like the first thing that they do?
Well, the first thing is just a rapid assessment of the situation.
Okay.
Taking in the whole picture,
Okay.
trying to rule out those most serious conditions as quickly as possible,
Yeah.
especially something like sepsis.
Sepsis.
Yeah, this is one that a lot of people might not be as familiar with, but
It can be really scary.
it can be very dangerous.
Yeah. So sepsis is when an infection
Mm-hmm.
triggers this chain reaction.
Yeah, it's like this massive inflammatory response.
Yeah. In your body, that can really wreak havoc on your organs. And if it's not caught early, it can be fatal.
Absolutely.
Yeah.
So what are the paramedics looking for to know that this fever isn't just a cold, but maybe it could be sepsis?
Okay, so they're looking for a few key things. First, a temperature above 38.5 degrees Celsius or 101.3 degrees Fahrenheit.
Oh, so that's like the magic number.
That's a big red flag.
Okay.
But it's not just about the temperature. They're also looking for potential sources of infection.
Okay.
So like pneumonia, a UTI, a wound, anything like that.
So just having a fever doesn't automatically mean sepsis.
Right.
There needs to be more to it.
Exactly.
Okay, so besides a really high fever
Yeah.
and maybe a sign of an infection,
Mhm.
what else are they looking for?
They're also looking for at least one of the following: low blood pressure, rapid breathing, or an altered mental state.
Okay, so those are like the big three along with the fever and the potential infection.
Yeah, those three things together with a fever can really point towards sepsis.
Okay, so let's break down those three things.
Okay.
Low blood pressure.
Low blood pressure can indicate that the infection is causing something called septic shock.
Septic shock.
Yeah. This is where the body is having trouble maintaining blood flow
Oh, wow.
because the inflammation is so widespread. So that's really serious.
Okay, and then rapid breathing. Why would that be a red flag?
So rapid breathing can happen when the body's trying to compensate for a lack of oxygen,
Oh.
which can be caused by the infection. Basically, the infection is interfering with the lungs' ability to do their job properly.
So the body's like working extra hard to try and breathe.
Exactly, trying to get enough oxygen.
Wow. Okay, and then altered mental state. What does that actually look like?
So this can range from things like confusion, disorientation, to being really sleepy or even unresponsive.
Oh, wow.
And it basically suggests that the infection might be affecting the brain.
Oh, that's scary.
Yeah, it's definitely a sign that things are serious.
Okay, so the paramedic is putting all these pieces together like a detective.
Exactly. They're trying to solve the mystery of what's causing this fever.
And if they find some of these red flags,
Then they move on to a more detailed secondary survey.
okay, what does that involve?
So this involves things like listening to the patient's lungs.
Okay.
Are there any crackles or wheezing?
Right.
Examining their skin for any signs of jaundice, rashes, dehydration, things like that.
Wow.
And checking for a stiff neck, which could be a sign of meningitis.
Oh, meningitis. That's another one.
Another scary one.
Meningitis is an inflammation of the membranes that surround the brain and spinal cord,
Wow.
and it can be caused by either bacteria or a virus.
Okay, so how would a paramedic know that maybe someone has meningitis?
So one telltale sign is a stiff neck. The patient would have difficulty touching their chin to their chest.
Oh, I see.
They might also have photophobia, which is sensitivity to light.
Okay.
And those symptoms combined with a high fever can be pretty strong indicators of meningitis.
It's amazing how much they can tell just from looking at a patient.
It really is like detective work.
Okay, so say they've ruled out some of these like immediate threats,
Yeah.
like sepsis or meningitis.
What happens next?
Well, the guidelines instruct them to remove any excess clothing from the patient
That's interesting.
to help cool them down passively.
Yeah, because you always hear like bundle up when you have a fever.
Right, you would think the goal would be to bring that fever down as quickly as possible.
Right.
But actually, aggressively cooling someone down can actually be counterproductive.
Really?
Yeah, it can shock the body and make the situation worse.
Oh, Susie.
The goal is to support the body's natural cooling mechanisms
Okay.
while addressing the underlying cause of the fever.
So it's not just about bringing the temperature down.
Right, it's about figuring out why the fever is happening in the first place.
Okay, so passive cooling is the way to go.
Exactly.
Got it. There's also another thing that the guidelines mention, and this is kind of scary.
Yeah. Oh.
Seizures,
Yeah,
especially in kids or adults with suspected serious conditions.
that is a real concern. A sudden spike in body temperature can trigger seizures, particularly in young children whose brains are still developing.
Yeah.
And in cases like meningitis, where the brain is already inflamed,
Right.
a fever can increase the risk even more.
So that's why it's so important to catch those things early.
Absolutely. And paramedics are trained to recognize the signs of an impending seizure and to manage one safely if it does occur.
Wow. So it's just incredible how much paramedics have to think about
Yeah, they have to be prepared for anything.
with something that we kind of take for granted, just like a fever.
Right, we've learned it's not just about the number on the thermometer, it's about understanding the whole picture.
Absolutely.
All the signals that the body is sending
Yeah.
and knowing how to respond appropriately.
So I guess the question now is for everyone listening.
Yeah.
How does this knowledge change your perspective on fevers?
I mean, will you look at a fever differently now, both in yourself and others,
Yeah.
knowing all the things that could be going on underneath?
It definitely makes you think twice.
It does.
Yeah.
So the next time you have a fever, maybe you'll appreciate the complexity of what your body is going through.
Definitely. And maybe don't hesitate to call a medical professional if you're concerned.
Absolutely better safe than sorry.
All right. Well, that's our deep dive for today.
I hope you learned something new about fevers.
Thanks for listening.
And stay healthy out there.
We rely on it every single day, right? Electricity. I mean, lights, phones, heat. Flip a switch and boom, it's there.
It's amazing, isn't it? So much of modern life just depends on it.
But that power, that same force that makes all that possible, it can turn dangerous in a split second.
Absolutely. And that's what makes this deep dive so fascinating, I think. We're going to explore the world of electrical injuries from a paramedic's perspective.
Exactly. Like picture this, sirens blaring, you pull up to a scene and someone's been hit with a serious electrical shock. What do you do?
Talk about high pressure. Where do you even begin?
Right. And that's what we're going to unpack. What are those critical protocols that paramedics use?
Yeah.
What do they need to know to save a life?
Because let me tell you, in these situations, every single second counts.
No time for hesitation
Yeah.
and the wrong move. Well, that could be disastrous, not only for the patient, but for the first responders, too.
Exactly. So let's say you are that paramedic, you've just arrived at the scene. What's the absolute first thing on your mind?
Well, after you've taken a deep breath,
Okay.
joking aside, it's got to be safety, right?
You got it. Scene safety is paramount. And, it's drilled into paramedics from day one. You do not, under any circumstances, approach a potential electrical source until it's 100% secured.
Meaning, yeah.
Meaning the power is O off F, downed lines. Those are handled by the experts, the utility crews. You don't want to become part of the circuit yourself.
Yeah, I think we've all seen those caution tape scenes in movies. It's not just for show.
Nope. Electricity always seeks the easiest path to the ground, and you don't want to be that path.
Makes sense. You absolutely do not want to become another victim. But, okay, let's say the scene is safe. You can approach.
Yeah.
What about those situations where you've got multiple victims, like after a lightning strike? How do you choose who to help first?
Triage, right. And this is where things get counterintuitive. You'd think you go to the person who looks the worst off, right?
Yeah, seems logical.
Well, in a lightning strike, it might be the opposite. Those who appear the worst off, the ones who seem to have no vital signs, they might actually have the best chance of survival.
Wait, hold on.
Yeah.
Really? That's kind of shocking. Explain that.
It's all about how that electrical current moves. Lightning, it's incredibly powerful, incredibly fast. So if someone's showing no signs of life, no pulse, not breathing, it could mean that the current passed through them so quickly it didn't have time to cause massive damage to their tissues.
Oh, so it was like in and out.
Exactly, like a super fast surge. Whereas someone who's conscious, who seems less injured, they might have actually experienced the current for a longer time, which means more internal damage that might not be immediately obvious.
That is wild. Okay, so scene secure. You triaged your patients. Now you've got someone in front of you with an electrical injury. What's going through a paramedic's mind at this point? What are those red flags?
Okay, so right away, they're thinking about all the potential threats, the things that could be going wrong internally. Well, the big ones: cardiac arrest. The heart just stops beating, or dysrhythmias, that's the medical term. Basically, the electrical shock throws the heart's rhythm completely out of whack.
And it's not beating effectively.
Right. And then, of course, there are burns, but those are just the tip of the iceberg, There's a lot more going on under the surface that you can't see right away.
So you've got the external burns, but there's probably a whole lot of damage you can't see.
Absolutely. We call it the iceberg effect. Electrical injuries, they can set off this whole cascade of problems. Think internal burns, damage to nerves, blood vessels, particularly in the limbs.
Which is what? Extremity neurovascular compromise, right? I remember that term from our prep.
You got it. And it's serious stuff, loss of sensation, problems with blood flow, and then it doesn't stop there. Seizures. Muscle spasms, so violent they can actually cause broken bones.
Oh, wow. So it's not just the electricity itself, it's the after effects, too.
Exactly. And some of these complications, they might not even show up right away.
So it's like a ticking time bomb almost. Okay, so how does a paramedic even begin to sort through all of that at the scene? It seems overwhelming.
Yeah, it definitely requires some quick thinking. One of the first things we try to figure out is what type E of electrical current was involved and what voltage are we talking about?
Right, because a shock from, say, a household outlet is very different from a high-voltage power line.
Huge difference. Higher the voltage, the greater the potential for damage. So we're gathering as much info as we can.
Makes sense. So while you're doing that visually, what's a paramedic looking for? I mean, burns are obvious, but what else?
Yeah, burns are the big one for sure. But we're also checking the color and temperature of the extremities. Pale, blue, cold. That could signal problems with blood flow, muscle twitching, any difficulty breathing. Those are all red flags too. And then if we can find entry and exit wounds, that helps us trace the path of the current through the body.
Like connecting the dots.
Exactly. And that gives us clues about which internal organs might have been affected.
So let's say you've done all that and the person seems, relatively okay. Does that mean they're in the clear? Can you breathe a sigh of relief?
Not so fast. One of the trickiest things with electrical injuries is the damage, it can evolve. What looks okay initially might not be okay a few minutes or even hours later.
So even if someone seems stable, you can't let your guard down.
Exactly. Ongoing monitoring is key. So let's say there were signs of compromised blood flow or nerve function in a limb. Maybe they couldn't feel their fingers or their toes. We're going to reassess that every 10 minutes. We call it serial neurovascular assessments.
To catch any changes early on. So let's talk treatment. What can paramedics actually DO in these situations?
Well, we always have to be ready for things to go downhill fast. Those heart rhythm problems, the delayed effects on limbs, you never know. So you might give medications to stabilize the heart, oxygen, IV fluids, and pain management is super important, obviously.
Yeah, I can only imagine.
Then, of course, we'll dress any burns, immobilize any fractures. You gotta be prepared for anything.
Sounds intense. So for our listeners out there, what's the big takeaway from all of this?
I'd say the biggest thing is understanding that electrical injuries are complex and they're often unpredictable. Just because someone looks okay on the surface doesn't mean they are okay.
Right, it's what's going on inside that counts.
Exactly. And that's why it's so crucial to have those trained professionals, the paramedics, the EMTs, the folks who know how to handle these situations, who know what to look for and how to respond.
Because it sounds like there's so much more to it than just, basic first aid.
Oh, absolutely. It's about critical thinking, quick decision making, and having a deep understanding of how electrical injuries can affect the body, both immediately and in the long term.
It's really amazing what they do. So for our listeners, to wrap things up, we want to leave you with something to think about. Imagine you're that paramedic. You've arrived at the scene. It's an electrical injury. You've made sure you're safe. What's the very next key thing you do?
Yeah, really think about it. Put yourself in those shoes. It's a great way to appreciate the challenges these folks face every day.
And if you're curious to learn more, we'll have some extra resources in the show notes.
Keep learning, folks, and stay safe out there.
Couldn't have said it better myself. All right, welcome everyone. Ready for another deep dive?
Always ready.
Okay, awesome. So you guys sent in this section of the dysphagia standard, right?
Yep, that's right.
And it's basically a guide for paramedics.
Yeah, it's how they handle patients having trouble swallowing.
Like full-on 9/11 situation, can't get food down,
Exactly.
that kind of thing. So we're going to break that down.
Should be interesting.
Yeah, I mean, besides being kind of fascinating, right?
Oh, for sure.
Knowing this stuff could actually be helpful too.
Absolutely.
Like, those medical shows everyone watches?
Yeah.
This helps you understand what they're actually doing.
And why they're doing it.
Right, the why. Or even just in your own life,
Be more aware.
Yeah, if you see someone struggling,
Mm-hmm.
you might notice things you wouldn't have before.
It can be eye-opening.
Okay, so picture this. You're out at a restaurant,
Okay.
and someone at the next table starts choking on their food.
Oh, geez.
They're coughing, face is turning red, the whole bit.
Scary situation.
So paramedics arrive. What's the very first thing they're going to do?
Well, right off the bat, they're looking for any immediate threats to life.
Okay, like what? Give me an example.
Like anaphylaxis.
Anaphylaxis, that's the...
Severe allergic reaction.
Yeah, right, where their throat swells up.
Exactly. That can cut off their airway completely.
So it's going to be dealt with instantly.
No time to waste.
Okay, what else?
Well, there are upper airway infections too, like epiglottitis.
Epiglottitis, I've heard of that, but remind me.
So the epiglottis is this little flap of tissue
Okay.
that covers your windpipe when you swallow.
Right, to keep food from going down the wrong way.
Yep. But with epiglottitis, it gets inflamed, swollen,
No.
and that can block the airway too.
So these are things paramedics are checking for right away.
Absolutely. Those take top priority.
But while they're doing that,
Yeah.
are they also thinking about the swallowing problem itself?
Oh, absolutely.
Yeah.
Paramedics are trained to, juggle a lot of possibilities at once.
They have to.
So, yeah, while they're addressing those life-threatening things, they're also doing what we call a secondary survey.
Okay, a secondary survey. Break that down for me.
Basically, it's a head-to-toe assessment, but in this case,
With swallowing,
they're really focusing on the head, neck, and lungs.
looking for clues about what's going on.
Exactly.
So what kind of clues are we talking about? Give me the detective work here.
All right, so they'll be looking for things like drooling
Drooling. Okay.
or a hoarse voice,
Yeah,
a cough, of course.
makes sense.
All those things could point to problems with swallowing or even the airway itself.
Okay, so it's like putting the pieces together?
Yeah, building that picture of what might be going on.
All right, what else?
They'll also check for any swelling in the neck,
Oh,
any masses they can feel,
uh-oh.
or even a deviated trachea.
Wait, back up a sec. A deviated trachea?
Yeah.
That sounds kind of serious.
It can be.
What does that even mean?
So the trachea is your windpipe, and it's normally right in the center of your neck.
Okay.
But if it's pushed to one side,
Yeah.
that can mean there's a buildup of pressure in the chest cavity.
Pressure. From what?
Often it's air leaking from the lung.
Oh, wow.
That's a condition called a tension pneumothorax.
Tension pneumothorax.
And it's a big deal.
So they're looking for a crooked windpipe, basically.
In a way, yeah. It's a sign that something's really wrong.
Wow. So much info just from looking at someone's neck.
Right. Paramedics are trained to pick up on those subtle cues.
And they also listen to lung sounds. Right?
Oh, absolutely. That's a key part of the assessment.
So what are they listening for there?
They're listening for any abnormal sounds, what we call adventitious sounds.
Adventitious.
Yeah.
Fancy word.
Just means unusual, basically.
Like, give me some examples. Like, what kind of sounds would be a red flag?
Well, wheezing could indicate constricted airways,
Mm.
or you might hear crackling sounds.
Crackling.
That could mean there's fluid in the lungs.
And that's bad.
Yeah. It could mean the person is aspirating.
Aspirating meaning?
Food or liquid is going down the wrong pipe into the lungs.
Ah, that's what I thought. Definitely don't want that.
Nope, not at all.
Okay, so this brings us to a part of the guidelines that I found really interesting.
Oh.
It says if they suspect epiglottitis, they're not supposed to inspect the airway.
Interesting, right.
Yeah, it seems kind of counterintuitive. Like, wouldn't you want to see what's going on in there?
You'd think so, but there's a good reason for that.
Okay, I'm all ears.
Remember, the epiglottis is already inflamed and swollen.
Right, right.
Well, trying to open the airway could actually make that swelling worse.
Oh, I see.
And that could completely obstruct breathing. It's a very delicate situation.
So it's more about not making things worse.
Exactly.
And I noticed, even if the patient needs oxygen,
Yeah.
the guidelines say to minimize agitation.
Right. Absolutely. Keeping the patient calm is super important.
Because freaking out wouldn't help.
Not at all. Stress and anxiety can actually make things worse.
So it's like calm and careful wins the day.
Pretty much.
All right, so let's say the paramedics have assessed the patient, figured out what's going on.
Okay.
How do they actually position someone who's having trouble swallowing?
The guidelines recommend a sitting or semi-sitting position.
Okay, why that?
Well, it helps keep the airway open, for one thing.
Makes sense.
And it reduces the risk of aspiration.
Because gravity's helping a bit.
Exactly. So it's easier for the patient to breathe and swallow.
It's like they're thinking 10 steps ahead.
Yeah.
This whole deep dive.
Yeah.
It's really shown me how much paramedics have to be prepared.
Oh, yeah, for sure.
The guidelines even talk about anticipating a complete airway obstruction
Got to be ready for anything.
and having all the tools ready to go, to act fast.
Preparedness is key in their line of work.
Totally. Okay, so to recap what we've learned today,
Hit me with it.
paramedics prioritize immediate life threats.
Number 1,
They conduct a thorough head-to-toe assessment.
leaving no stone unturned.
They pay super close attention to those specific signs and symptoms we talked about.
The clues,
And they're always prepared for the unexpected.
always thinking on their feet.
It's impressive, honestly.
It really is. Gives you a new appreciation for what they do.
Absolutely. So here's something for everyone listening to think about.
Ooh, I like this part.
Knowing these procedures,
Yeah.
how might it change the way you observe someone who's struggling to swallow? Or how you might react in an emergency?
Food for thought, for sure.
Right. Sometimes understanding the why behind these procedures
Yeah,
can make us more aware, more prepared in our own lives.
definitely. Knowledge is power, as they say.
Couldn't have said it better myself. Thanks for joining us for this deep dive, everyone.
See you next time.
We'll catch you on the next one. All right, everybody, welcome back. We are diving deep today into heat-related illnesses
Yeah.
and how to deal with them.
Yeah.
We've got this paramedic standard guide here,
Mm-hmm.
and it's really interesting stuff. So this is a really good deep dive for
Yeah.
anybody who's thinking about doing a summer job,
Right.
like lifeguarding or maybe volunteering at an outdoor event or anything like that.
If you're going to be outside.
Yeah, exactly.
This is really good info to have.
So let's just jump right into it. One of the things that I found really interesting
Okay.
is that even something like a small thing like heat cramps
Mm-hmm.
can actually be a sign
Oh, yeah.
that something more serious is
Absolutely.
to be going on.
Yeah, you really have to pay attention to even the mild stuff.
Okay,
Because it's going to be the early warning sign.
so how would a paramedic or someone who is trained know
Yeah.
what to look for?
Yeah.
What are the different levels or types of heat-related illnesses?
Well, we can start with heat syncope,
Yeah.
which is basically just a fancy word for fainting when it's
yeah.
caused by heat.
Gotcha.
So, somebody's out in the heat, they haven't been drinking enough fluids, they're not used to it, they might just faint.
Okay.
And that's their body's way of kind of shutting things down.
Yeah, just shutting
He's
your
trying to
neck.
protect itself.
That makes sense.
But it definitely shouldn't be ignored.
Okay.
If someone faints in the heat, that's a sign that we need to take action.
Absolutely. So heat syncope, basically fainting, passing out.
Yeah.
What about heat cramps? I feel like a lot of people have had heat cramps at some point.
Oh, yeah, for sure.
What's the difference there?
So heat cramps, those are those painful muscle spasms.
Mm.
Usually we're talking about large muscle groups like
Okay.
your calves or your hamstrings.
Yeah.
And those happen when you're sweating a lot and losing electrolytes.
Okay, so it's not just the heat itself, it's the loss of fluids and electrolytes.
Right, because those electrolytes like sodium and potassium, they're essential for your muscles to function properly. And when you lose too much of them, those muscles start to cramp up.
Okay, so heat syncope is like the warning. Heat cramps are maybe a little bit more serious.
Mm-hmm.
What about heat exhaustion?
All right, so heat exhaustion is where we start to see things get more serious.
Okay.
And this is when we see symptoms like a headache, nausea. You might feel weak, dizzy, lightheaded.
Yeah.
And what's interesting here is that the guide actually makes a distinction between how heat exhaustion can present in a younger, healthy person
Okay.
versus an older person.
Interesting. Why would that be different?
Well, in younger, healthier folks, they're usually sweating a lot
Right.
because their body is trying to cool down.
Right.
But as we get older, our body's ability to sweat as efficiently can decline.
Oh.
So you might actually see an older person with heat exhaustion who has dry skin
Wow.
because they're not sweating as much.
So that's a good thing to keep in mind, because you might look at someone and think, oh, they're not sweating, so they must be okay.
Oh, right, exactly.
But they might actually be in a more dangerous situation.
Exactly.
Gotcha. So we've got those three:
Yeah.
heat syncope, heat cramps, heat exhaustion.
Mm-hmm.
Now we've got stroke,
Heat stroke.
which the guide describes as like super serious.
Yeah, heat stroke is life-threatening.
Yeah.
It can come on really quickly.
So what happens in the body when someone is having a heat stroke?
Basically, their body's internal cooling system completely breaks down, and their temperature just keeps rising.
Oh, wow.
And it can cause all sorts of problems.
The guide actually uses a term that I found kind of scary: severely altered mental status.
Yeah.
What does that even mean?
It means that they might be confused, they might be disoriented, they might not even be responsive. And then on top of that, you can have seizures, you can even go into a coma.
So it sounds like if you suspect someone's having a heat stroke, it's like 911 immediately.
Absolutely, call 911 immediately.
Okay.
But then there are some things you can do while you're waiting for help to arrive.
Okay, like what? What are some of those things?
First and foremost, get them out of the heat.
Yeah.
Get them into a cooler environment.
Okay.
And if you can, remove any unnecessary clothing,
Okay.
because that'll help them cool down faster.
So like take off a jacket or anything that's heavy.
Exactly.
Okay, so get them into a cooler environment, remove extra clothing. What about fluids? Should you give them water or something?
That's where it gets a little tricky.
Right.
If they're conscious and alert and able to swallow safely, then you can offer them small sips of water or an electrolyte drink.
Mm-hmm.
But if you suspect heat stroke, or if they're not able to swallow properly, then do not give them anything by mouth.
Okay, and why is that?
Because there's a risk that they could aspirate, which means that the fluid goes into their lungs instead of their stomach.
Right, that makes sense. So cool environment, remove extra clothing, maybe some fluids, but only if it's safe. Anything else we can do?
Yeah, for heat stroke specifically, the guide talks about active cooling measures. So things like applying cool, wet cloths or ice packs to the person's skin.
Where would you put those?
Focus on areas like the armpits, the groin, the neck, and the head.
So it's not just like putting a cold washcloth on their forehead. It's more targeted.
Right,
If
because
that-
those are areas where there are a lot of blood vessels close to the surface.
That makes sense.
And by cooling those areas, you can help to cool down the blood and therefore cool down the entire body.
Okay, and I imagine you're monitoring them while you're doing this.
Absolutely.
Because if they start shivering or if they seem like they're getting better, you might need to back off a little bit. You don't want to overcool them.
Exactly. You need to be responsive to how they're doing.
Wow, okay. So that's a lot of information, but I think it's really important information for people to have,
Absolutely.
especially as we head into the summer months.
For sure.
We've talked a lot about recognizing the signs of these different heat-related illnesses, knowing what to do, calling 911 if it's serious. But what about prevention? What can we do to try to avoid these situations in the first place?
Well, staying hydrated is probably the most important thing.
Yeah.
Make sure you're drinking plenty of fluids, especially if you're going to be outside in the heat.
Right. And I bet wearing light-colored, lightweight clothing would help too.
Yeah, absolutely.
And avoiding strenuous activity during the hottest parts of the day.
Definitely.
And even if you do feel like you need to be outside during those times, taking breaks, getting into the shade, all that good stuff.
And it's also worth mentioning that some medications can make you more susceptible to heat illness.
Oh, interesting.
So if you're taking any medications, it's a good idea to talk to your doctor
Yeah, good point.
about whether they might increase your risk.
Okay, wow. This has been really informative.
Good.
I feel like I've learned a lot,
Yeah,
and I hope our listeners have too.
me too.
It's so important to be able to recognize the signs of heat illness
Right.
and know what to do. And remember, even if someone seems like they're getting better, it's always a good idea to err on the side of caution
Mm-hmm.
and seek medical attention.
Definitely.
So here's something to think about. We talked about staying hydrated. We talked about avoiding those peak heat hours. But what about acclimatizing yourself to the heat?
Yeah.
How does gradually exposing yourself to heat help prevent heat-related illnesses?
Mm.
That's something for you to think about.
It's an important question.
As you continue your exploration of this topic,
Absolutely.
stay safe and cool out there,
Yeah.
everyone.
Yes, be careful out there.
All right, we'll see you next time.
See you later.
All right, everyone, welcome back. Ready for another deep dive?
Always ready.
Today, we're tackling something I know we've all dealt with at some point. That, oh no, moment when something gets stuck in your eye or your ear or even your nose.
Ugh, don't even remind me. It's like instant panic, right?
Absolutely. But we're going beyond just basic first aid tips today. We're going to be diving deep into what paramedics actually do and what their guidelines say about these situations. Think of it as getting the inside scoop so you can stay calm and make the best decisions in those stressful moments.
Yeah, because let's be real, a lot of times knowing what not to do is just as important, if not more important, than knowing what to do. We want to make sure we're not making things worse, right?
Exactly.
Good.
So no frantic Google searches while you're dealing with a screaming toddler with a bead up their nose. We got you covered.
We've got your back.
So before we break down each area, I think it's important to highlight that golden rule. The one thing everyone should remember, no matter what, don't try to remove the object yourself.
That's the big one.
But why? I mean, sometimes it seems like such a simple fix. What's the worst that could happen?
Well, let me tell you, I've seen some pretty gnarly things in my time as a paramedic.
Oh, I bet.
It's not pretty. Like, imagine trying to get a tiny speck of dust out of your eye and accidentally scratching your cornea with your fingernail.
Oh, I can feel that just thinking about it.
Right. Or, picture this. A kid shoves a Lego up their nose.
Oh, no, I've been there.
And a well-meaning parent tries to fish it out with tweezers, but ends up pushing it further in, lodging it even deeper. Or even worse, causing a nosebleed.
It's a recipe for disaster, my friend. You got to resist that urge to play doctor.
Okay, I'm officially terrified. So when you talk about things like scratching your cornea or pushing something further into the ear canal, can you explain what exactly we're talking about here? Like, what's the anatomy involved and what's the potential long-term damage? Sure. So the cornea, for example, is that clear front part of your eye. Think of it like a window to your soul, you know? It needs to be perfectly smooth and clear for you to see properly. And it's incredibly sensitive. Even a tiny scratch can cause pain, blurry vision, and in some cases, even infection.
Wow, that's scary.
Right. And then you mentioned the ear canal. Now, the ear canal is this delicate, curved passageway that leads to your eardrum. Now, the eardrum is this thin, delicate membrane that vibrates when sound waves hit it, sending those signals to your brain so you can hear. If you push something too far into the ear canal, you could easily damage the eardrum, which can lead to hearing loss, balance problems, and a whole host of other issues.
No poking around in there. Got it.
Exactly. Leave it to the professionals.
Okay, so let's break down each scenario a bit more. Let's start with the eyes. Let's say something flies into my eye. What should I do? What are the first steps?
All right, so first things first. Don't rub your eye. I know it's tempting, but trust me, rubbing will only make things worse. It can scratch your cornea or even push the object in further.
Okay, no rubbing. What next?
Try to get a good look at your eye. If you can see the object and it's on the white part of your eye, not on the cornea, you might be able to gently flush it out with water or saline solution.
So flushing is usually the go-to solution.
In most cases, yes. But, you know, there's actually one interesting exception to that don't touch it rule.
Oh, really?
Yeah. If the object is on the white part of your eye, not on that super sensitive cornea we talked about, and it's easily accessible, a skilled professional, again, not you at home, might attempt to remove it with a sterile swab or a piece of gauze, but they have to be very careful and know what they're doing.
So it really is all about protecting that cornea.
That cornea is precious. We got to keep it safe.
Got it. Now back to flushing. What's the best way to do that?
Well, you want to use lukewarm water or a saline solution. You can find those little eye wash bottles at the drugstore.
Yeah, I've seen those.
Yep, those are great to have on hand. Okay, so tilt your head so that the affected eye is lower, and gently pour the water or saline from the inner corner of your eye outwards. This helps to flush the object away from your tear duct.
Oh, smart. Okay, so that's for the eyes. Now let's move on to ears. We all know this is a super common problem, especially with kids. Like, seriously, why do they love to stick things in their ears so much?
It's like a magnet, isn't it?
It's baffling.
It is. And look, the same basic principles apply. Don't try to remove the object yourself. You could push it further in and damage the eardrum.
Right, because the ear canal is all curvy and delicate, and we don't want to mess with that.
Exactly. So the best thing to do is cover the ear with a clean cloth or a bandage and head to the doctor. They have special tools and techniques for safely removing foreign objects from the ear canal.
Okay, that makes sense. So eyes and ears were covered. Let's tackle the nose.
Yeah.
Now, I got to admit, whenever I see a kid with something stuck up their nose, I kind of chuckle a little inside because, we've all seen those funny sitcom episodes where this happens.
It's a classic.
But in all seriousness, how dangerous is it really, and what should we do?
So while it might seem funny on TV, it's actually nothing to joke about in real life.
Yeah, of course.
Those nasal passages, they're surprisingly complex. They're like a maze in there, and they're lined with delicate tissues and blood vessels. Trying to remove something yourself can cause a lot of damage.
Oh, I bet.
You could push the object further back, causing it to get lodged in a really awkward spot. You could trigger a nosebleed, and even introduce bacteria that lead to a nasty infection.
Okay, you've officially convinced me. Hands off the nose.
Exactly. So the takeaway here is the same as with the eyes and ears. Cover the nostril with a clean cloth if possible, and seek professional help. Let the doctor handle it.
Got it. So I think we've covered a lot of ground here today. The overarching message is pretty clear. When it comes to foreign objects stuck in your eyes, ears, or nose, less is more. Resist the urge to play doctor and seek professional help.
Exactly. You know, it's interesting, though, isn't it? Why do we have this almost primal urge to immediately try to fix things ourselves? Like, we see something that doesn't belong and we just got to get it out of there.
Right, it's like an instinct.
It is. But maybe this whole foreign body situation is a good reminder that sometimes the best course of action is to step back, observe, and call in the experts. It's about knowing our limits and when to seek help. And that applies to so many things in life, not just first aid.
I love that. That's a great takeaway. So listeners, next time you encounter this situation, remember what we've talked about today. Stay calm, resist the urge to DIY, and seek professional help. Your eyes, ears, and nose will thank you.
Absolutely. And remember, sometimes the best thing you can do is just leave it alone.
So true. Thanks for listening, everyone, and we'll see you next time for another deep dive. Okay, so picture this. You're with your grandma, right? And
Yeah.
she takes a tumble.
No.
It doesn't seem too bad. Maybe a little scrape.
Yeah.
But how can you really tell if something more serious is going on?
Right.
Well, that's what we're diving into today.
Yeah.
We're taking a close look at some guidelines for paramedics who are working with geriatric patients.
Mm-hmm.
And believe me, this is information that could be really helpful to anyone, I think.
For sure.
Because we're all going to get older.
Absolutely. And, these guidelines are all about understanding the unique needs that older adults have, especially when they're facing an emergency.
Right.
Like in that situation you just described.
Exactly. And one of the first things that these guidelines emphasize is the importance of not jumping to conclusions about a geriatric patient's abilities.
Really important point.
Yeah. They actually specifically say to assume that geriatric patients have normal hearing, sight, speech, mobility, and mental function, unless you're given clear evidence that that's not the case.
That's interesting because I think that really challenges some of the stereotypes and assumptions that we might have about older people without even realizing it,
It totally does. And this is where ageism can really sneak in and, color our perceptions without us even realizing it.
Yeah.
I was reading a story actually about a man in his 80s who was involved in a car accident.
Oh, wow.
And when he was brought to the ER, he seemed kind of confused and disoriented.
Right.
And so the staff initially assumed that he might have dementia.
Oh, I see.
But it turned out that he was just having trouble hearing and understanding what was going on around him.
Wow.
A simple hearing aid totally changed the situation.
It's amazing how quickly we can jump to these assumptions about people's cognitive abilities, especially when they're older.
Right.
And, this example really illustrates why those guidelines are so crucial.
Yeah.
They remind paramedics to treat every single patient as an individual, not a stereotype.
Exactly. And another really important factor is that as we age, our bodies can respond differently to illness and injury.
For sure.
The guidelines actually use this term, atypical presentations,
Uh-huh.
which means basically that the symptoms that older adults exhibit might not be the same as what you'd expect in a younger person.
Right.
So it can be a bit trickier to diagnose what's really going on.
Absolutely. I mean, just to give you an example, the guidelines specifically mention that older adults might have a diminished response to things like pain or infection or even extreme temperatures like heat and cold.
That's interesting.
And you can imagine how this could lead to some surprises, right?
Definitely. So like a seemingly minor fall could actually involve a fracture
Right.
that the patient doesn't even realize is that serious.
Exactly, because their pain response might be muted.
Wow. That's kind of scary.
Yeah. It's definitely a challenge for paramedics because they have to balance being cautious with also being efficient.
Right.
In the situations, it really comes down to their training. They're trained to look for very subtle clues and to ask very specific questions to try to get a clear picture of what's really happening with the patient.
So they really have to slow down and be extra observant.
Absolutely. And they rely heavily on things like vital signs and other objective measures to help them make the right decisions.
It's about like slowing down, being extra observant, and really listening to the patient, isn't it?
Precisely. And that leads us to another really important point that these guidelines emphasize:
Mm-hmm.
vulnerability and respect.
Yeah, the guidelines talk a lot about the need to handle older patients very gently to avoid injuring their skin.
Yes, that's right, because their skin is often thinner and much more prone to tearing and bruising than a younger person's skin.
Right.
Paramedics are trained to be incredibly cautious with their movements and procedures when working with geriatric patients.
They don't want to cause more harm than good.
Exactly. And it's not just about the physical care. It's also about recognizing that older adults may be more vulnerable in a variety of ways.
That makes sense. And this actually connects to another guideline that caught my attention.
Okay.
The one about medication sensitivity.
Ah, yes, of course.
Older adults are much more susceptible to side effects and adverse reactions from medications already.
Absolutely. And that can make things even more complicated because those side effects could actually be mistaken for symptoms of a different condition.
Yeah, so it's like another layer of complexity that paramedics have to consider.
Exactly.
Now, there's a section in these guidelines that I found really fascinating.
Okay.
It instructs paramedics to actually assess the patient's living accommodations and their ability to perform what are called activities of daily living.
Yes.
Now, why would that be relevant in an emergency situation?
Well, it's all about understanding the whole person, not just the immediate medical crisis that they're facing.
Okay.
For example, imagine someone who's struggling to make meals or even get around their own home. Treating their sprained ankle is only one part of the solution. You also need to consider their overall well-being and how they're going to manage once they're back home.
It's like taking a broader view.
Exactly. And the guidelines actually give a list of these activities of daily living.
They do.
Things like bathing dressing, eating, using the toilet.
Basic stuff.
Basic but essential. And if someone is having difficulty with any of these tasks, that could be a sign that they need additional support.
I see.
And thankfully, the guidelines actually point paramedics to some really valuable resources that can help
Okay.
organizations like Community Care Access Centers, which can coordinate home care services,
Wow.
and 211, which is a helpline that connects people to various social services.
That's great to know. And wouldn't relatives, friends, and neighbors also be a good source of information in these situations?
Absolutely. They might be able to give paramedics really valuable insights into the patient's usual level of function, their support system, whether there have been any recent changes in their health or behavior.
Yeah. So it's like piecing together a puzzle to get a full picture of the person's needs.
Exactly.
Now, we need to shift gears a little bit and talk about a topic that's really sensitive but absolutely crucial.
Okay.
And it's highlighted in these guidelines as well. Elder abuse.
Yeah.
How common is this? And what are the signs that paramedics should be on the lookout for?
It's a really heartbreaking reality, and the sad truth is that elder abuse is far more prevalent than many people realize.
Really?
Yeah, studies have shown that it's a very significant problem, and paramedics are trained to be vigilant
For what kinds of things?
for any signs of possible abuse, such as unexplained injuries,
Hmm.
or if the patient seems fearful, withdrawn, or if there are inconsistencies in the information that they're given.
I see.
Those are all red flags.
And are there clear instructions for paramedics on how to handle these situations?
Absolutely. The guidelines are very clear.
Okay.
They emphasize that any suspicion of elder abuse, whether it's physical, emotional, financial, or neglect, requires immediate action.
Wow.
They should offer to contact the police, alert the receiving facility staff, and carefully document all of their observations.
So these guidelines really empower them to act as advocates for potentially vulnerable patients.
Exactly. They have a responsibility to protect those who might not be able to protect themselves.
That's really powerful. And so we've covered a lot of ground here.
We have.
What would you say are the key takeaways for our listeners from all of this?
Well, I think these guidelines offer a powerful reminder that aging affects how people experience and express health issues. And they highlight the need for a heightened level of vigilance, respect, and a holistic approach to caring for older adults.
We need to see the whole person, not just the immediate medical problem.
Exactly. And of course, we can't ignore the reality of elder abuse.
Absolutely not.
We all have a role to play in protecting older adults in our communities.
I think that's a really important message. And, as we wrap up this deep dive, it would be great if our listeners could take a moment to reflect on their own interactions with older adults.
Right.
Think about how you can apply these principles of respect, understanding, and attentiveness in your everyday life.
Yeah, how can we as individuals and as a society contribute to creating a world that truly values and safeguards its elders?
That's a great question to leave our listeners with.
Food for thought.
Definitely.
Thanks for having me.
It's been great having you. Okay, so have you ever seen those trucks on the highway?
With the placards.
Yeah, the diamond-shaped ones with all the crazy numbers and symbols.
Oh, yeah.
Like, what even are those?
Hazmat warnings.
Hazmat warnings, yeah.
Yeah.
That's a paramedic's first clue when they roll up on a hazmat injury.
Like their first clue to the scene.
So today, we're going deep on hazmat injuries.
Right.
How do paramedics even assess the situation?
Yeah. What are their priorities?
Because obviously safety is the number one thing
Huge.
for everybody.
Absolutely.
So how do they even approach this? Because I would be terrified if I rolled up on something like that.
It's a high-stakes situation, right?
Yeah.
Every second counts.
Yeah.
They got to be ready for literally anything.
Like I remember one time I was in traffic
Okay.
and I was stuck behind one of these trucks
Mm-hmm.
that had like a skull and crossbones on it.
Oh, wow.
And I was just like, what if that stuff spills?
Right.
Like what on earth,
Oh, yeah.
what are the first responders going to DO?
Oh, that's the question that keeps paramedics up at night.
I bet.
Yeah. So the first thing on their mind is always life over limb.
Okay.
So are there immediate life threats?
Interesting.
If there's a chemical in the eye that could mean vision loss,
Oh, wow.
obviously burns are a major concern.
Yeah.
And then there's the risk of the substance being absorbed through the skin and becoming toxic.
Oh, so it could be like multiple things happening at once.
Absolutely.
So not just the immediate like burn,
Yeah.
but then like what happens later on?
Yeah, exactly.
Gosh, it's so scary.
Yeah.
So, okay, they get to the scene. They see this truck maybe
Yeah.
with whatever symbol on it.
Yeah.
How do they even know what they're dealing with?
Right.
Not like there's a label that says, danger.
Chemical X.
Exactly.
Right.
Chemical egg spilled here.
It really is like a medical mystery sometimes.
Like a puzzle.
Oh, right.
We got to solve it fast.
Exactly.
So what are their clues?
So the first thing they'll do is check for those placards. But they also might talk to anyone at the scene,
Okay.
like firefighters or bystanders who witnessed the accident.
Right. So it's like a whole team effort.
Absolutely. Yeah, it's all hands on deck.
Yeah.
And they also have some incredible resources.
Like-
Like they've got Canutech.
Can you tell?
Think of it as like a 247 hotline for all things hazmat.
So they can call and be like, hey, we got this symbol. What is this?
Pretty much, yeah.
Wow.
They can even pull up the emergency response guidebook.
Uh,
Gives them step-by-step instructions for handling almost any hazardous material.
Like a choose your own adventure.
Kinda, yeah.
But for hazmat?
Yeah,
That's wild.
it's pretty comprehensive.
Wow.
And then if they need even more information,
Okay.
they can access the Material Safety Data Sheet.
MSAS.
MSDS.
I've heard of that.
Yeah. Or even call the Poison Control Center.
Okay, so they've got a lot of
A
resources
lot of resources.
that
I
they
know.
can kind of pull from to figure out what to do.
Yeah, exactly.
Wow, that's incredible.
Yeah.
But I'm sure there are some cases where, like, even the guidebook doesn't have the answer.
Oh, absolutely.
Or, like, what about those water-reactive chemicals you mentioned?
Oh, yeah, those are a big one.
That sounds pretty scary.
Yeah, like imagine a chemical like sodium that reacts violently with water,
Oh, gosh.
and someone tries to wash it off with a hose.
Oh no.
That's why identifying the substance is so important.
Right.
There are specific protocols for each chemical,
Okay.
and sometimes irrigation with water is the last thing you want to do.
Wow. So it's, like, really important to figure out what it is before you just start doing things.
Yeah, you don't want to make it worse.
No, exactly.
Right.
So, okay, let's say it is something that can be irrigated.
Right.
What are the steps then?
So decontamination is key,
Okay.
and it often starts before they even get into the ambulance.
Okay.
Paramedics will try to remove any contaminated clothing or jewelry
Right.
and begin the decontamination process right there at the scene.
Right there on site.
Yeah, it's not always easy,
I-
especially if someone is in pain and scared.
Yeah. I can only imagine.
Right.
Like a medical emergency, AD, a hazmat situation, all in one.
Exactly.
So are there specific guidelines for irrigation?
Oh, absolutely.
Okay.
The minimum irrigation time depends on the type of burn.
Okay.
Like alkali burns need at least 20 minutes of continuous irrigation,
Wow.
ideally starting at the scene
Okay.
and continuing on the way to the hospital.
Wow.
Acid burns need a minimum of 10 minutes.
Okay.
And for an unknown chemical,
Yeah.
20 minutes minimum.
Okay. So you just err on the side of caution.
Absolutely better safe than sorry.
Right.
Yeah.
Gosh. Okay. So even the irrigation itself has so much nuance. I
Yeah.
remember reading about those eye wash stations in labs.
Yeah.
I bet eye irrigation is even more complex
Oh, yeah, for sure.
because you got to get all up in there.
Well, and you got to make sure it doesn't spread to the other eye or down into the tear ducts.
Oh, I didn't even think about that.
Right?
Oh my gosh.
You might even need to hold the eyelids open manually to make sure the water reaches every part of the eye.
Oh gosh, that sounds intense.
It's definitely a specialized skill.
Yeah, I bet.
Yeah.
So what happens after irrigation?
Well, they're not out of the woods yet.
Okay.
Paramedics will manually remove any remaining solid particles,
Okay.
and then they'll cover the affected areas with wet dressings or cowls.
Got it.
But just as important as the physical decontamination is communication.
Okay.
They need to let the receiving hospital know exactly what they're dealing with.
Oh, right. So that the hospital can be ready
Yeah.
and know what's coming in.
Exactly what the substance is, how much exposure there was, what decontamination efforts they've taken.
Right. So it's kind of like a relay race.
Yeah, you could say that.
Like you're passing the baton to the next team
Exactly.
to continue on with the treatment.
Right.
That's a good way to put it.
Yeah.
Okay. Well, speaking of passing things along,
Mm-hmm.
did you ever think about what happens to the ambulance? Like if the ambulance gets contaminated,
Absolutely.
I didn't even think about that.
Yeah, I can't just drive around all contaminated.
Right. I guess not.
So
Right.
if the ambulance comes into contact with the hazardous material, it has to be completely decontaminated,
Wow.
even if it means delaying transport.
That's dedication right there.
For sure.
Wow.
Yeah.
So for our listeners who might not be super familiar with all of this hazmat stuff,
Yeah.
what is like the one thing you would want them to take away from this?
I think the biggest takeaway is that hazmat injuries are complex,
Okay.
and they require a very specific approach.
Got it.
Quick thinking, accurate assessment, and meticulous decontamination are all crucial.
Yeah, that makes sense.
And remember, the Transport Canada Emergency Response Guidebook is a publicly available resource.
Oh, right.
So you never know, familiarizing yourself with it might come in handy someday.
That's good advice, actually.
Yeah.
You never know when you might need it.
Right.
So yeah, gosh, it's amazing how much expertise goes into keeping everybody safe in these situations.
It's incredible.
So thank you for sharing all your insights
Of course.
and breaking down this complex world for us.
Happy to do it.
And to our listeners, thank you for coming on this deep dive with us.
Yeah. Thanks for listening.
We'll catch you next time.
See you then.
Bye.
Bye. Ever imagine yourself in one of those crazy medical dramas, you know? Where it's like every second counts and the right call could like save a life.
Oh, yeah, totally.
Well, today we're diving into the real world equivalent,
Oh, wow.
field trauma triage.
Cool.
We're going to be unpacking how paramedics make those critical decisions out in the field.
Right.
And we're going to be using a source document that's like their playbook.
Okay.
the field trauma triage standard.
That's pretty fascinating stuff.
It is.
Yeah, it's not just about slapping on a bandage or anything.
Right.
It's about understanding what you can't see.
Oh.
How, like, a seemingly minor injury can actually be masking a life-threatening situation,
Oh, wow.
and how to get that patient to the right level of care fast.
So we're talking about identifying who needs just a regular hospital versus a specialized trauma center.
You got it.
Right.
Exactly.
I'm guessing it's way more complex than just looking for the biggest cut or something.
Oh, yeah, for sure. Think of it like a detective investigating a crime scene. The paramedics are looking for clues, but those clues aren't always obvious.
Right.
They start with something everybody's familiar with.
Okay.
Vital signs.
Okay, so blood pressure, pulse, and all that jazz.
Yep.
But how do those simple things tell you if somebody needs to go to a trauma center?
Because they're often the first indication that something's wrong internally,
Okay.
even if there's no, like, massive bleeding that you can see.
Right.
So imagine a car accident
Mm-hmm.
and the person's conscious,
Right.
but their blood pressure is, like, plummeting.
Oh, wow.
That's a huge red flag.
Yeah.
It could mean internal bleeding, a collapsed lung,
Oh, God.
something that needs immediate specialized intervention.
So it's like the vital signs are like whispering a secret message
Yes.
about what's happening under the surface.
Exactly.
That's kind of spooky,
It is.
but also pretty cool.
Yeah, it is. And that's why paramedics are so attuned to even, like, slight deviations from the norm,
I see.
especially when it comes to specific patient groups. Like, for example, an infant breathing too slowly,
Mm-hmm.
that could point to a really serious problem, even if they look fine on the outside.
I see.
Oh, yeah.
I'm starting to see why this isn't just like basic first aid.
Right.
This is about understanding the whole puzzle of the injury.
Yeah, you're getting it.
Right.
It's about connecting the dots
Okay.
between what they see on the patient
Mm-hmm.
and what they know about how the injury happened.
Right.
The mechanism of injury.
Mechanism of injury.
Yes,
That sounds kind of fancy.
it does, doesn't it?
What's the layman's version of that?
Okay, think of it like this.
Okay.
Falling off a skateboard
Mm-hmm.
is very different from falling out of a second-story window.
Yeah, definitely.
Right.
Right.
Even if the visible injuries seem similar,
Uh-huh.
the forces involved
Okay.
are totally different,
Right.
meaning the potential for internal damage
Okay.
is way higher in that second scenario.
So even if you don't see like an actual broken bone, the way somebody got hurt can tell you how likely a broken bone or worse might be lurking under the surface.
Exactly. Let's say someone has a crushed extremity.
Okay.
That might not kill them right away,
Right.
but we could be talking potential vascular compromise.
Okay.
So that means blood vessels are damaged,
Uh,
which needs very specific surgical skills, often microsurgery.
okay.
And you only find that at a trauma center.
Okay, now I see why getting people to the right hospital
Mhm.
matters just as much as getting them to any hospital quickly.
Yes.
There's that whole golden hour thing I've heard of, right?
There is, and the field trauma triage standard directly addresses that.
Okay.
So if a patient meets the criteria for a trauma center,
Mm-hmm.
and they can get there by ambulance within 30 minutes,
Okay.
that's where they go.
Right.
Sometimes they might even bypass a closer hospital to get to that specialized care faster.
Wow. So even choosing which hospital route to take
Yeah.
is part of this whole triage system. It's
Yeah.
way more intricate than I realized.
It is, because those minutes can make all the difference
Right.
between life and death,
Gosh.
or between full recovery
Yeah.
and long-term complications.
So we've got vital signs as clues
Mm.
and this mechanism of injury detective work.
Right.
What other pieces of the puzzle are paramedics looking at?
Well, certain injuries are just automatic red flags,
Oh, okay.
things that scream trauma center,
Okay.
no matter what.
Gotcha.
So we're talking penetrating wounds to the chest or abdomen, multiple broken bones,
Mm-hmm.
basically things that strongly suggest a high risk of major internal damage.
So those are like instant clues,
Yeah.
bypassing some of that initial
Yeah.
assessment. Like
Yeah.
if you see that, you
Yeah.
know, it's serious time.
Exactly. But even with those, the details still matter.
Okay.
It's not just like a gunshot wound.
Right.
The type of gun used,
Mm-hmm.
all that feeds into the bigger picture.
Yeah.
Same for falls.
Okay.
A trip on the sidewalk is way different from a fall from a roof.
Oh, yeah, for sure.
Right. So let's put this into practice.
Okay.
Imagine you're a paramedic arriving at a car crash.
Okay.
What are you looking for that would make you think trauma center right away?
Okay, so I'm scanning the scene before I even get to the patient.
Yes. You're scanning the scene before you even reach the patient.
Okay.
How badly is the car damaged?
Okay.
Is there intrusion into the passenger compartment,
Okay.
meaning the car crumpled inwards?
Right.
If that intrusion is more than 30 centimeters,
Oh, wow.
that's a huge indicator of the force involved,
Okay.
meaning high risk of internal injury.
I'm guessing that's because our bodies can only take so much force
Right.
before something on the inside gives way,
Exactly.
even if the outside doesn't show it.
Precisely. And then you've got things like ejection from the vehicle,
Oh, God.
or if there was a death in the same car,
Right.
those automatically bump up the urgency
Yeah.
because the forces were clearly massive.
Wow, it's like a whole different level of observation skills
It is.
than I had ever considered. So you're taking in the big picture, the specific injuries.
Uh-huh.
What else is on the paramedics' mental checklist?
There's a whole category called special criteria,
Okay.
and this is where it gets really interesting.
Okay.
Things like the patient's age,
Mm-hmm.
if they're pregnant, if they have pre-existing conditions, all this could dramatically change how an injury is perceived.
Okay, so age makes sense.
Right.
Frail elderly person, probably more vulnerable.
Exactly.
But why pregnancy or like existing health issues?
Because those factors can mask the usual signs of trouble
Oh.
or make seemingly minor injuries way more serious.
Okay.
Think about an elderly person falling down a few stairs.
Okay.
Might not seem like much to like a younger person,
Yeah.
but their bones are more brittle. They might be on blood thinners.
Oh, right.
So a simple fall can be a fractured hip and internal bleeding waiting to happen.
And that's where that 30-minute transport window becomes even more critical.
Absolutely.
Yeah.
Every minute counts, especially with those special criteria patients.
Right.
But it's not just about speed.
Okay.
It's about getting them to the right specialists.
Right.
A pregnant woman who's been in even a minor car accident needs a trauma team that's equipped for both her and the fetus.
Wow.
That's not something every hospital can handle.
This is reminding me of that saying, not all heroes wear capes.
I love that.
These paramedics are out there making life or death decisions
Right.
based on so much more than just what the average person would know.
They are. And it's not just about checking boxes on a form.
Right.
They're constantly communicating with the receiving hospital,
Okay.
painting a picture of the situation so the ER team is ready.
I see.
It's teamwork,
Right.
even from miles away.
So this field trauma triage standard is like the language they all speak?
Yes,
Making sure everyone's on the same page from the accident scene to the operating room.
it is. And one of the big decisions this system helps with
Okay.
is whether an air ambulance is needed.
Okay, now that's where my inner kid gets excited.
Right.
Helicopters.
Yeah.
But seriously, how does this triage standard play into that decision?
Mhm.
Isn't that just based on like how far away the hospital is? I figured distance was a big factor, but knowing how this whole triage system works, I'm guessing it's way more nuanced than that.
You're right. It's not just about miles.
Okay.
It's about what we call the time criticality of the injury.
Okay.
Some things just need that specialized trauma center care ASA,
Right.
no matter what.
Yeah.
Think major bleeding,
Mhm.
severe head injuries, those kinds of things.
So even if a hospital is technically closer,
Right.
if it's not equipped for that level of trauma care,
Exactly.
the helicopter ride to a further away trauma center is actually the faster option
Yes.
in terms of getting the right care.
Time to the right treatment is what matters.
Okay.
And the field trauma triage standard helps paramedics make that judgment call right there on the scene.
Gosh,
It's like they're weighing time, distance, and the severity of the injury all at once.
that's a lot of pressure.
It is.
I'm picturing them with like a mental calculator in their head,
Right.
doing all these equations while somebody's bleeding beside them.
It's definitely intense, but they're highly trained for it.
Right.
And it's not just their decision alone.
Okay.
They're in communication with air ambulance dispatch,
Uh-huh.
giving them the vital signs, the mechanism of injury, all those details we've been discussing.
So it's like a joint decision,
It is.
making sure the helicopter is the right call.
Absolutely. It's about resources, too.
Right.
Helicopters are expensive.
Yeah.
They have limited range with it.
Yeah.
Weather can ground them.
Of course.
It's not something you do lightly.
It makes sense. It's got to be more than just, this looks bad, let's get the chopper.
Right. It's also about what's best for the patient at that moment.
Right.
Sometimes, even if the criteria are met,
Mm-hmm.
ground transport might be smoother, safer,
Okay.
especially if the person is already stabilized.
Right.
It's a judgment call based on the whole picture.
Man, we've only scratched the surface of what these paramedics do. This field trauma triage standard,
Mm-hmm.
it's not just a document.
Yeah.
It's like their mental toolkit for navigating chaos.
It is. And it's constantly evolving
Oh, wow.
based on research, new technologies, all that.
I see.
What's fascinating to me is that even though it's super technical,
Yeah.
it boils down to one core idea.
Okay.
getting the right care
Uh-huh.
to the right patient at
Right.
the right time.
And knowing this stuff, even just as a regular person,
Right.
it makes you appreciate those first responders even more.
Oh, yeah.
They're not just showing up.
Yeah.
They're showing up with this whole system of knowledge,
Ex-
guiding their every move.
And for a listener out there, hopefully this deep dive has given you a little glimpse into that system.
I think so.
Maybe it makes you feel a bit more prepared,
Right.
knowing what questions to ask
Yeah.
if you're ever in that scary situation.
Right.
Or just makes you look at those ambulances a little differently.
That's a great point. We've all seen those flashing lights rushing by. But now I'm thinking about the person inside,
Mm-hmm.
making those split-second decisions based on all this intricate knowledge.
It is.
It's pretty amazing.
It is. And knowing a little bit about how it works, maybe that empowers all of us to be a bit more informed,
Yeah.
a bit more helpful.
Right.
Should we ever be in a position to assist in an emergency?
Knowledge is power, they say.
It is.
And in this case, it could literally be life-saving power.
Absolutely.
Thanks for taking us on this deep dive.
It was my pleasure.
I feel like I learned a whole semester's worth of stuff
Oh, wow.
in just a few minutes.
Remember, folks, stay curious, stay safe,
Yes.
and hopefully never need this info firsthand,
Right.
but be glad it exists just in case.